Were you told by your dentist that you need a root canal? A dentist may have told you this whether or not you have pain. So you might be wondering, why do I need a root canal? So in this video, we will be talking about the 7 reasons why you might need a root canal for your tooth. Hi, I'm Dr. William Park with Blessed Smile and Smile on You Dentistry. Today we will be talking about root canals and why one has been recommended for you. But before we get started, if you like our content and you appreciate what we're doing, make sure to hit that like button and subscribe to our channel. We really appreciate it. So let's get into it. Root canal treatment, or a root canal, is needed when the soft tissue or the pulp inside of the tooth where the blood vessels and nerves are lying become inflamed or infected and cannot be restored back to a state of health. The symptoms of an infected tooth can vary. Sometimes you may have pain, sometimes you won't, but the treatment required would still be the same. It would be a root canal treatment. So why do you need a root canal? What are some of the things to look out for if you think you may need one? So here are some of the most common symptoms that patients experience when they do need a root canal treatment. Number 1 would be constant toothache. If you have constant pain or irritation that is not caused by anything specific going on in your mouth, you may need a root canal treatment. Lingering sensitivity. Sometimes it is normal to experience some mild sensitivity to hot foods and cold foods. But if this is prolonged, you're having some cold food and it's hurting you for like 5-10 minutes, it may be a sign that you need a root canal. Discharge or drainage. If there's drainage from the root of your tooth, this may signify that you have an infection going on, in which case a root canal would be recommended for you. Another reason would be tooth discoloration. If your tooth has a grayish, blackish appearance to it, it could be due to an infection of that pulp that we talked about. If this is the case, a root canal treatment will be recommended for you to take care of this infection. The 5th reason that you may need a root canal is if you have a toothache that feels like it's kind of going on in the bone area. Experiencing an ache in the bone that's surrounding the tooth is a common symptom of an abscessed tooth or an infected tooth. Next would be if you have a toothache when you're chewing. If you are experiencing pain when you're chewing or biting, this may mean that you have an infection present for your tooth. The last reason that you may need a root canal would be if you have swelling of your gums. If you find that your gums are sore or swollen, this may be an indication that the pulp or the tooth may be infected. So if you are experiencing any of these symptoms that we've talked about, make sure to schedule an appointment with your dentist. They will take some x-rays and do some diagnostic tests to determine what is going on and to determine if root canal treatment would be the right treatment for you. So now you may be thinking, now I know why I need a root canal, but what is a root canal? To go over it simply, the tooth has a canal inside of it that holds all the nerves and the blood vessels inside of the tooth. When you have a big cavity or a big infection going on, this irritates the nerve and this can start to cause a lot of pain for you. So in order to fix this, we clean out the nerve area, we disinfect everything, and we fill that canal up. So I hope this video does give you some information about why you may need a root canal. Again, if you are experiencing any of the symptoms that we talked about, make sure to make an appointment with your local dentist. If you are in the Los Angeles or Orange County area, we would love to have you come in for a consultation at our office. You can find us at smileonyouDentistry.com. Thank you for watching.